As more people become impacted by COVID-19, health officials say it is not uncommon for anyone else trying to get other non-COVID needs addressed to experience setbacks.
5 on your side's Travis Cummings spoke to one physician in town who says he is committed to stepping in when others cannot.
We're seeing 150 people a day at each location. Our volume easily quadrupled.
Dr. Sonny Saggar and his staff at 24/7 Healthcare have had their hands tied since the beginning of the pandemic.
Primary care doctors' offices were closed. A lot of urgent cares like us were open.
They're the only two urgent care facilities in the region open around the clock. As COVID surges yet again with Omicron at play, his office hopes to continue being that saving grace.
So we're preparing for the worst.
Especially as patients run into long lines and delays for issues other than COVID at hospitals and clinics. He points to a lack of resources and manpower for that.
We did actually have a lot of primary care doctors send their patients to us to get medication refills, which are very important, especially if you think about asthma inhalers for an asthmatic or insulin for a diabetic.
Saggar says it's also not uncommon for people to run into issues virtually. That's if health facilities don't have someone dedicated specifically to those patients as his facilities do.
And if they're getting overwhelmed with patients in front of them, the telemedicine becomes a lower priority.
Hagar's optimistic that COVID will slow after the impact the holiday surge might have. Until then, he asks society to be resilient and respectful in the process.
All we can do is be patient and be thankful for what we have.
Travis Cummings.
24/7 Healthcare has two locations, one in downtown St. Louis and another in Creve Coeur. And the doctor says you can show up, get a COVID swab, be it rapid or PCR, and the least busy time is between 11 p.m. and 5 a.m., and you can pre-register online.